Kulkarni sir, thank you very much. Thank you very much for those kind words. And you are very special and unique. And I know that you have a passion, a real passion in technologies. And we are honored that Kulkarni sir is sharing this session. And hello to my co-speakers and my friend Jayaprakash Sai and Dr. Vishal and others. So first of all, thank you very much. Thank you very much, RSSDA, for this opportunity. So the topic today is something different. The topic today is to compare the two modalities of continuous glucose monitoring. Because we have been using continuous glucose monitoring in India. Many doctors have started using, many doctors are continuously using it. So why not speak something different? So this is a global landscape. So when I say global, most of them, many of them are unfortunately not commercially available in our country. Why is it commercially? Because all of us know that some of the patients are using devices which are not available, which are not marketed in our country. So this is how it has evolved. This is how the CGM has evolved, not globally, in our country. We started using CGMS Gold in the year 2005. Yes, continuous glucose monitoring is available in India since 2005. And initially it was only a research tool. And the name of the device, CGMS Gold, has gradually been the name of the technology itself, that is CGMS. And then came iPro in between, the insulin pumps and the connected sensors. 6 years ago, the launch of Libre Pro. So we were just listening to the discussion a while ago. So Libre Pro was really revolutionary. It made CGM available and affordable for the common man. And then came the Guardian Connect. I will be speaking more about Guardian Connect. That is a real-time device, only RT device available in our country. And then the Freestyle Libre. And this was officially launched in the November of last year, 2020. Again, a path-breaking innovation. The Freestyle Libre, a path-breaking innovation. So if somebody is asking you how you can classify the CGM, here you go. This is the answer. The continuous glucose monitoring devices can be classified into real-time or ISCGM. So real-time is the value, the number is available live in real time, continuously, either on your mobile phone or on a reader or on a monitor. And you don't require any intervention for getting these results, getting these numbers. Whereas in an intermittently scanned CGM, ISCGM, the glucose levels are continuously transmitted, but it is not displayed. It is not displayed. So you require a reader, and the reader need to be scanned over the sensor. And the sensor, when it is scanned, will provide you with the reading. And this reading will be available continuously, but there are certain limitations which we will be discussing later. And then you have the blinded CGM. So that is another classification. It can be divided into blinded, that is professional or personal. So blinded means, it is, one example is Libre Pro, which has been the most popular CGM in India, still the most popular CGM in India for the last 6 years, where the data is available only when you download. Otherwise, the numbers are not visible. Or it can be personal. Personal means the patient is procuring it. It is owned by the patient. The sensor, the reader, or whatever device is there, it is owned by the patient. There is one more classification, one more category of continuous glucose monitoring, and that is ICGM, which stands for integrated CGM. So I would say that this is more or less like a teaching lecture. So there is a difference between ISCGM and ICGM. ISCGM means I need to scan for the results, whereas ICGM is integrated CGM, where the CGM is open. The data, the software is open, and it can be integrated with other dosing algorithms, such as which is used along with a connected insulin pen, or with a glucose meter, or along with a do-it-yourself artificial pancreas, or it can be along with connected glucose meters for calibration. So why there is a renewed interest in CGM? So that is a very relevant question. Why there has been a renewed interest? in the uptake of continuous glucose monitoring all over the world. Why we keep on discussing this here? The reason is the international recommendation on adopting ambulatory glucose profile and the time in range. So time in range is gradually, but I would say that in many parts of the world, it is rapidly replacing the conventional glucose metrics. A time in range of minimum recommended is more than 70%. But I will say, with the regular use of continuous glucose monitoring, we, the doctors, along with our patients, will be able to successfully reach TAR above 90% in majority of our patients. And that is our experience, which we have already published. For every 10% reduction in the time in range, say from 70 to 60 or from 60 to 50, there is an increase in the occurrence of retinopathy by 64%, nephropathy by 40%. More data is accumulating, which is there even existing for macrovascular complications. So TAR is different from A1C. We have also recently published the data on how the South Asians will perform and how in South Asia the TAR correlates with hemoglobin A1C. Look at the three phases of A1C, a very popular slide, a very familiar slide to all the doctors and all the healthcare professionals. All the three patients will have or might have the same hemoglobin A1C of say 7%. But the glycemic variability, the percentage time which is spent in normal, which is 100% for the third person, whereas it is only 18%, just 18% for the person on the left. So hemoglobin A1C is only an average of high, normal, and low. It doesn't provide you with any information. It doesn't provide any information on the duration spent in hyper, the magnitude of hypoglycemia, the number of glucose excursions, the time below range, and so on. And you have the detailed information on intraday and interday variability with the aid of time in range and continuous glucose monitoring. And now the question, where did it begin? When did we start doing continuous glucose monitoring with real-time devices in India? Which came first? The answer is the real-time devices came first, along with insulin pumps. And we started doing this in the year 2006 exactly. So it's almost 15 years now. And from 2007 onwards, you can see that the size of the transmitter is shrunken in size. And earlier, patients used to come from other countries to have deployment in our center. I still remember those old days. And this is how the ISCGM evolved. That is intermittently scanned CGM evolved. So if I look at me, I will do a demonstration. So this is the reader, and this is my sensor, and this is how the intermittently scanned device will work. So my glucose reading is 117. So we started with a professional device, and then came the Libre. These two devices, they are not available in our country. This is Libre 2 and this is Libre 3. Why Libre 3? This is also transforming. From intermittently scanned, this is also transforming to real-time devices. So Freestyle Libre 3, which probably will be launched in India also in the coming years, it is a truly real-time device. Minute-to-minute readings are sent directly to the mobile phone. And the app is also different. The Libre link is replaced by Freestyle Libre 3 app. And this is moving from the conventional on-demand, that is whenever you are scanning, you get a data. And that is transforming to always on. But there again, there is a difference. If you look at the size of the sensor over here, it is 70% less in size when compared to the previous generation of Libre Freestyle sensors. So let me now focus. Let me now come to focus. Let me compare the two devices which are available in India. Guardian Connect as a real-time and Libre from Freestyle, and that is the intermittently scanned device. First of all, the Guardian Connect. So Guardian Connect, as you can see over here, the Guardian Connect sensor need to be connected via Bluetooth, and this can be connected to your mobile phone. And in this example, it is an Apple phone. Earlier, it used to be only Apple phones. Now it can connect to most of the Android phones as well. And this is also available in your desktop or your laptop or in the browser on your mobile phone in real time. So what is special about Guardian Connect? Guardian Connect is one of the most successful and popular continuous glucose monitoring devices from the innovators of CGM's goal. It can provide you with an alert when it is rising or falling, or when the glucose is about to fall, or about to go down or go high, and it will also give you an alert on high or on low. And all these can be programmed. All these can be programmed on your mobile phone. You can program on selecting the threshold of low and high. You can also define on when the alert should be programmed. It can be 10 minutes before a hypo, or it can be even 1 hour before a hypo or hyperglycemia, even 1 hour. So from 10 minutes to 60 minutes, you can program the hypo or hyper alerts. And this is my Apple Watch, and this is an SMS alert in my phone displaying on my watch. And this is for a patient whom we are intensely monitoring. So it can also provide you with SMS alerts. And this is how the trend arrows are appearing, 1, 2, and 3 arrows, depending upon how fast is the glucose going up or down. And the display in your mobile phone screen, the glucose, the interstitial glucose is displayed at the top panel, and you have the graph at the bottom panel. And this is a CareLink download from Guardian Connect. So this is the initial data of a person. For an example, 25% time in range. And the patient is regularly on follow. The patient is being followed by the diabetes team. The patient is empowered, and he is on biphasic insulin twice daily, liraglutide along with oral therapies with more than 20 years of diabetes duration. Just look at the data 1 month later, 100% time. That is an incredible data, 100% time in range with no time below range. Absolutely no hypo or hyperglycemia. So this is a miracle when you are using continuous glucose monitoring devices. Of course, the data need to be interpreted, the patients need to be empowered, and the data need to be translated to meaningful changes, modifications in dosages as well as lifestyles. And moving on to the Freestyle Libre, another path-breaking innovation. And this is how the reader can display not only the interstitial glucose data, but again the trend arrows, the time in range. The time in range is again displayed on the reader itself. So it's very easy. And this is how the trend arrows is going to help the patient determine whether he should be exercising or whether he should be dosing or whether he should be modifying the dosages, not only of medications, but also on the diet. What about the accuracy? This is a very often asked question. What about the accuracy? Accuracy of these devices are measured with the help of mean absolute relative difference or MARD. So lower the MARD, higher the accuracy. So in the earlier days, the MARD used to be 30, then 25, 20. The MARD used to be higher for type 1 diabetes for the same sensor. But on an average, we have been very successful with the advancement in technologies to reach a MARD, which is a single digit number, which is less than 10 now. So this is the new Libre with the new algorithm reaching a MARD of 9.2%. So this is 9.2%, whereas it is still lower for Guardian Connect. It is 8.7% for Guardian Connect. So essential differences will be, this requires a calibration. Guardian Connect will require calibration 1 or 2 times per day, whereas Libre doesn't require any calibration at all. And if you look at the Sugar IQ Assist, which is unfortunately not available in India, it is also superior for Guardian Connect. The sensor, unfortunately, will last only for 7 days with GC. Whereas with a much lower cost, with a much affordable for many in India, the sensor lasts for 14 days. 14 days, which is much more cost effective. And you don't require a transmitter. And that is again an advantage when you are using the IS CGM. Whereas the other CGMs are much more advanced. This is the Medtronic Guardian Connect sensor, which is connected. This is the next generation of Guardian Connect, which connects to the upcoming automated insulin delivery device. that is 780G, which is scheduled for launch in our country in India by the end of this month in November. So this is going to be the automated insulin delivery system, which will be self-adjusting every 5 minutes for both hypo and hyper. And it will be semi-automated even for bolus delivery. So this is the first of its kind automated insulin delivery system. And we are reaching stage 4 of automation for AID, that is automated insulin delivery devices, which is a new terminology for artificial pancreas. The same CGMs, if they are integrated CGM, this can be utilized for creating our own artificial pancreas. And this is DIY, the do-it-yourself of artificial pancreas, where the insulin pumps can even be the old models. I would say that when we are creating AP or AID, it is not the insulin pumps which are important because they are all the same. It is the development and the advancement in the sensors which are helping with the development of DIY, the new hybrid model insulin pumps and the AIDs. And this is again a recognition for our country. This is a 2021 clinical practice recommendations from the AS on advanced technologies in diabetes, where they have incorporated an original study on continuous glucose monitoring from India. So this is, of course, an acknowledgement of our original research from India on the use of technologies in diabetes. So let me now move on to the comparing. In the comparison, a couple of studies are available. This is how we can compare a real-time CGM such as Guardian Connect with intermittently scan flash glucose monitoring with Libre. It is a randomized control trial. There is an exercise phase, there is a home phase. And if you look at the bars, there are the green bars representing the ISCGM and the blue bars are representing the Guardian Connect or the real-time continuously on CGM. And you can see the differences, and this is time below range, below 70, and this is time in range, phenomenally different between the two devices. The real-time device is associated with less of hypo both for level 1 and the level 2 hypoglycemia, that is below 70 and below 54. And there is a significantly higher percentage of time between 70 and 180 when you are making use of real-time CGM devices. Each one of those will have its own strengths and limitations. The strength with the real-time is the data, which is continuously available with no action required. And it even allows calibration with a glucose meter. And the limitations are almost the same because you require a glucose meter for calibration, but the sensor life is only 7 days. The cost is very high. The cost is very high. And paracetamol interference is also a concern. And what about the strengths and limitations with an intermittently scanned CGM? The strength, I would say, no calibration required. And the biggest drawback, I would say, you have to scan the sensor every 8 hours, at least 3 times in 24 hours. Otherwise, the data will be lost. Because if I'm forgetting to scan my sensor, which happens very often because I don't have diabetes, I will lose the data. So that is the biggest drawback. And it does not allow for calibration or recalibration. And you need to retest when you are making dosing recommendations. So this is Diamond trial, another evidence on the use of RT-CGM. And this is a large trial on multiple daily injection users, which is again shown an improvement in all the glucose metrics, hemoglobin A1C, and this is in type 1 and type 2 diabetes participants in hypo, hyper, and moderate to severe reduction in hypoglycemia. And another randomized clinical trial, and this is in type 1 diabetes, IMPACT. Randomized control study to evaluate the impact of novel glucose sensing technology. So there is, you can see that with Libre, there is a 38% reduction in hypoglycemia. 38% reduction in hypoglycemia. So that is phenomenal. This is a robust data. Another one, almost similar to IMPACT, this is a replace in type 2 diabetes. Same with the Libre sensor, 43% reduction in time spent in hypoglycemia despite less frequent scanning. Even though you're not scanning that frequently, 8 versus 15, still there is a reduction in hypoglycemia. And many of you could have seen that there is a reduction in insulin dosages as well when the patients are using CGM frequently. This is alert 1. Again, demonstrating with the use of RT-CGM versus IS-CGM, a significant improvement in hypoglycemia, a significant improvement in hemoglobin A1C, and even improvement in the hypoglycemia survey score with the use of real-time devices. This is sharing some of the secrets. This is Myo, which can be placed on top of the sensor to convert this to a real-time device. And Night Rider is also available in India online. Of course, these are not regulated. These are not tested devices. And this is GLIMP, and this is Tomato app. Of course, this cannot be and should not be discussed in our forum, but many patients are using this for converting the IS-CGM into a real-time device. And this is the Honorable President of RSSDA, Dr. Benshi Sabu, and our team strongly recommending the urgent use of time in range in routine clinical practice. So these are my broad conclusions. Diabetes care is rapidly getting digitalized, and that is a need of the hour. And the CGMs have evolved, and it is now smaller, very user-friendly and reliable. Every CGM will have its own merits, demerits, limitations, and benefits. And you need to customize. And this is my nurse educator. She's still working with me, and this is a picture in 2006 holding the then CGMS Gold, a cumbersome device. And this is the first ever CGM which was introduced in India in 2005. So thank you very much, my dear friends, for your patient hearing.